Good morning, everyone. Good afternoon. Good evening. Welcome to this webinar, Paris 2024 Summer Games, Protect Your Participants from Risks. So before starting, could you please confirm me that you can hear us by writing yes in the question or the chat tab, please? Great. Thank you. If during the webinar you face some technical issues, you can connect with your phone by using the phone number that is written in the confirmation email you received. Please do not hesitate to ask all your questions during the webinar. Our experts will take the time to answer all of them after the presentation. So thank you. And Laetitia, Dr. De Rossi, Tarun, the floor is yours.
Thank you very much, Jennifer. Welcome, everyone. Good evening, good afternoon, good morning. I'm Laetitia Chaques. I'm the project manager for the Paris Summer Games 2024 at International SOS. And I'm today joined by our experts, Dr. Arnaud De Rossi, our regional medical director, and Tarun Niger, our lead security analyst for Europe. In the session today, we will obviously discuss about the Paris 2024 Summer Games and go a little bit more into the details of the security risk recommendations with Tarun and the health risk recommendations with the Dr. Arnaud De Rossi. We will then have obviously some part about how International SOS can better support you as an organization. And we will finish our session today with the Q&A session. So please feel free to ask all your questions in the chat tab or in the question tab, and we will take some time at the end to answer that. Tarun, floor is yours for the security risk and recommendations.
Thanks a lot, Laetitia. So before we jump into the nitty-gritty of the security environment, I thought I would just kick off things with our top line risk rating for the country, just to give an overview of things. As with the majority of Europe, we currently do assess it to be a low-risk destination. We assess this fairly regularly, and it takes into account several factors. But I think it's quite important to understand that France is unfortunately not that simple. It is much more nuanced than the term low risk indicates. And as the lead security analyst for Europe, I can tell you now that France is definitely one of the countries that gives me the most work, as well as our wider global threat monitoring team. I'm sure many of you listening in will have prepared for other sporting events, but the Paris Olympics, I'd say, they represent a much different sporting event from a security standpoint to, say, maybe the Tokyo Games, in which there were fewer threat actors, or the Qatar Football World Cup, which was a much more tightly controlled security environment. France can be quite febrile at times, and there are several risks that visitors might face during their time there. If you could just move to the next slide, please, Laetitia. Thank you very much. So I'd say in roughly the next 15 or 20 minutes, I'm going to give you an overview of all these risks. To keep it simple, I've placed them into 4 different buckets. So activism, of which there are a few different strands, terrorism, crime, and then we'll finish with logistics and infrastructure. Due to some sort of time constraints, this is going to be more of an introduction to the security environment, a bit more broad, but we will be producing a more granular insight report at the start of next year. There'll be a few other releases, including a monthly security forecast, a regional security forecast, some audio briefings, and then another webinar next year as we approach the games. But yeah, to get started with, we'll speak about activism. So for those who don't know, although I imagine there are some French attendees on the call, the French do have a long and proud history of protest. It's really embedded within their culture. To be honest, I can only commend them on their ability to rally such sizable numbers of people, whether it be over social or political issues. And I'm going to start with the latter one, so the political issues, because in the first 6 months of this year, there were nationwide demonstrations in opposition to a very, very controversial decision by the government to increase the pension age, something that not many people obviously are going to be very happy about. Now, this activity continued for months on end, at the height of which we were tracking more than 1 million people on the streets. In Paris alone, the capital, there were more than 500,000 people on the streets. It brought several cities to an absolute, well, an almost absolute standstill. If you could just move to the next slide, please. Thank you. So yeah, I mean, for the most part, they were peaceful. As with most protests in France, there was some localized violence towards the end of the rallies. This is generally ascribed to members of the anarchist left-leaning Black Bloc group. They often fight with police. The police themselves, they have a tendency, or they are slightly renowned for being heavy-handed in their response. And they're also infamous across Europe for their frequent use of tear gas, which we saw a lot of during those protests. Beyond this, roads were blockaded, including key routes to airports. Airports themselves were also directly targeted. And although this activity has tapered off, it's pretty much ceased entirely as we go into the tail end of the year. I don't think we or you guys should rule out the possibility that such rallies, they could be revived as we move closer to the Olympics. In fact, the Olympics headquarters was actually targeted and stormed during the demonstrations. So it is a possible flashpoint that could be used perhaps in some way to inject a bit of life into the movement. In terms of any, I guess, if we could just move back one slide, Letitia, sorry. We'll come to that in a second. In terms of any lessons learned from this, so key takeaways or impact, I think it's worth remembering that certain issues in France can draw huge numbers of people onto the streets. We're talking hundreds of thousands, like I said, not just in Paris, but countrywide, north to south, west to east, in urban centers, rural towns, and quite crucially, for weeks on end. So they don't just fizzle out after the first iteration. Like I said, whether or not they're going to be revived remains to be seen. But I think this example more underlines how political events can really drive protest activity. If we compare this to, say, for example, the UK, where I'm from, domestic political events don't generally result in people on the streets. In France, they do. So as a manager, I'd say it's immensely important to keep an eye on what's going on at the political level, because any legislative changes or governmental decisions, they could probably trigger something similar. Now on to the next slide. Thank you. That being said, it's not just politics that can generate unrest, but also what happens at a local level. So within communities, particularly those that feel disenfranchised, that can really trigger some sort of protests. The picture you have in front of you is from June of this year. It's taken amid the riots that broke out following the fatal shooting of a 17-year-old male by a police officer in Nanterre, which is a suburb of Paris. What followed this and what we were seeing was roughly about 5 nights of quite violent unrest. Thousands of people were arrested, dozens were injured. Next slide, please, Leticia. Thank you. And as you can see from this map, so with these 5 nights of unrest, the similarity with the pension reform protest is that the unrest spread across the country. So it affected several cities, including those where the Olympics are going to be held, including Paris, Bordeaux, Marseille, Lyon, and Lille. The difference, however, between these riots, we'll say, and the pension reform protests, which were fairly structured, is that the riots were, I mean, as expected, to an extent, a lot more spontaneous. So more often than not, there was little more than a call to protest in the evening. This then escalated and spiraled into unrest. Operationally, a very difficult time for those on the ground. Public transport was shut down. Several routes were blocked by cars or bins that were all set on fire. Anecdotally, I was actually on a bus from Bordeaux to Madrid, which did get held up for a very long time by these blockades. It wasn't a nice experience to be stuck on a road with cars on fire at either end, but it happened. I would say the key takeaways from this sort of unrest for you to think about would be, one, it's very, very hard to plan for and to predict, if not impossible. So in this instance, a teenager was killed, and hours later, there were people on the streets. Number two, the protests can turn ugly. Unfortunately, there is a lot of pent-up anger within certain communities, and some of this frustration can boil over into massive amounts of violence, and what some may see as a sort of, I guess, scattergun destruction of sorts. And then finally, in terms of key takeaways, it's really integral that you keep your ear close to the ground with a particular focus on local news, because like I said, something might occur in an area unknown to many, and before you know it, the country has been engulfed or seemingly engulfed by consecutive nights of rioting. Next slide. Thank you. Penultimately, in terms of activism, I think it's important just briefly to mention that there will likely be some sort of anti-Olympics activism. There's a group that we've been monitoring known as Saccage 2024. They formed a while back. They basically come together on the ideology that the Olympics is going to cause ecological and social destruction. Interestingly, there have also been a few reports that we've been tracking that some of their members might pose as fake volunteers to get within the Olympics and then disrupt the games from within. Of course, I imagine there are going to be some very stringent checks in place, but with 45,000 volunteers needed to support the games, there's always going to be a chance of someone making it through. Next slide. Thank you. And it's also highly likely that these activists are going to be joined by a range of other environmental and social movements. And I wouldn't say that it's just actual events that might be targeted, as you see in the picture in front of you, where a climate activist disrupted a rugby match in the UK. But companies with commercial ties to the games, those sponsoring it, for example, they should also anticipate and plan for the possibility that they might be the focus of such activism. So, for example, during the recent Rugby World Cup in France, which I'll say did promisingly pass off without any sort of notable incident, climate activists spread oil across the entrance of the French Rugby Federation, basically to criticize sponsorship from certain partners. So just to reiterate, if you think your organization falls within this category, it's really important that you consider your exposure to such activism. Next slide, Leticia. Thank you. Now, moving beyond social unrest, there is, of course, the ever-present in Europe and in France specter of terrorism. And the Olympics in general, I mean, it goes without saying with every big event, it represents a very high-value target for terror actors and associated groups. Lots of publicity, lots of people. But when you combine this with the fact that the Olympics are being held in France, I mean, honestly, a country historically disliked by many of these groups, and which has probably experienced the most attacks in Europe out of any I can think of in recent years, it would be naive to think this threat doesn't exist. And earlier this year, so the French Interior Minister actually did state that they were tracking an increasing likelihood of, I guess, a resurgence of the Islamist terrorist threat. And then just over a month ago, unfortunately, as some of you might know, a teacher was fatally stabbed about an hour south of Lille. I'll caveat this by saying it still remains a low probability, high impact sort of threat, but the risk remains of something slipping through the net. Nobody's perfect, including intelligence and security agencies. Ultimately, the games are going to be an extremely complex operation for authorities to handle. I mean, if we just consider the opening ceremony itself, of which you have a mock-up, I think it's like an AI-generated image in front of you, it's incredibly unique in that it will be open to the public and private spectators alike. There's going to be an estimated 500,000 people expected to show up. But if we think more to the modus operandi of what we might expect from these actors, previously we think of France, we think large-scale coordinated incidents, as with the Paris attacks in 2015. But these sort of attacks, they've massively decreased in frequency. And what we see more regularly now are lone radicalized individuals as the perpetrators. And they're not just limited to Paris or to other capitals, to other cities, sorry. They can take place in any urban center or even rural town. Beyond this, it's very common in France to see short notice evacuations at transport hubs or tourist sites. I'll be honest with you, more often than not, it is due to lost luggage, but it creates a lot of disruption and fear. And I think this is something that you should really be, I guess, feeding to any of your employees who might be traveling to France for the games. There is a realistic possibility that they'll have trains disrupted. They themselves might have to evacuate an area due to a bomb hoax. But hopefully, the forewarning and knowledge of this should dispel somewhat the fears they might have in that moment. Next slide, please, Leticia. Thank you. So, switching to the other end of the spectrum, towards a much more common risk, that would be crime. This in itself can be split into two separate categories, although they, of course, interlinked in some way. First would be of organized crime, impacts of which are generally felt in terms of drug trafficking, turf wars, predominantly in the suburbs of Paris, Lyon, and Marseille. Fortunately, these incidents, or the majority of them, are targeted. They take place in areas that business travelers are unlikely to visit, but it does really underline the need to ensure that anyone visiting France during this time, they know which areas have elevated risks of criminality so that they can avoid them. One thing I did also want to mention about organized crime, like I said, generally limited to certain areas, but there was a trend a couple of years ago in which celebrities had their accommodation targeted and valuables worth millions of euros stolen. And in one of the most high-profile cases, a very well-known celebrity was actually held at gunpoint in her hotel, while the criminals then made off with her jewelry. So what I'm trying to get at here is that there's a bit of a need to maintain a low profile when traveling, perhaps for certain levels of executives. Don't go around advertising on social media what hotel you're staying at. Keep your itinerary to yourself, because you're quite simply just increasing the risk of robbery. Next slide, please. But the sort of crime that we assess to be much more likely to impact, I guess, the general traveler during the games is that of petty crime. So, for example, pickpocketing of those perceived to be tourists or at least not locals. And this can take place on the metro, particularly in Paris, which is quite prone to such activity, as well as any tourist hotspots. Although there's obviously going to be a visibly heightened police presence across France, there's no doubt that criminals are going to increase their activity in line with the influx of tourists and potential targets. And sure, yeah, it might seem like a small risk in comparison to protests or terror attacks, but having your passport or your phone stolen can be a massive headache when you're in a foreign country and you don't speak the language, or the police might not necessarily have the best hold on English. Next slide, please. Thank you. And yeah, this feeds nicely into the next consideration that I think should be taken into account. So how do I want my workforce to be getting around during the games? Should we be booking them private transport, or are public options safe? Of course, this is going to be somewhat dependent on the profile of the traveler, but public transport is for the most part reliable and safe, provided you're sensible and not entirely aware to your surroundings. That being said, strikes, as with protests, are fairly, if not very common in France. For example, during the pension reform demonstrations, there was nationwide industrial action, significant train cancellations and delays. If we look ahead to the games, one of the largest labor unions, the CGT, they've already begun ramping up its demands in anticipation of the games. And they've said that industrial action could take place through January, February, March, and April. So if you do indeed wish to avoid such problems, there is, of course, the option of hiring a local ground transport or logistics provider. But given how many people are going to travel to France for this, there's going to be an associated upwards pressure on such cars and drivers. Next slide, please. And then, yeah, finally, just from a security and infrastructural standpoint, any organizations planning travel to France are going to need appropriate accommodation. It's worth considering that July and August are likely to be very, very hot. So this year, temperatures of up to 40 degrees or 104 Fahrenheit were recorded. Anyone not accustomed to such heat, suitable amenities, air conditioning within your accommodation, that's going to be key. In terms of basic level security, France is, like I said, low risk. Majority of business class hotels should be up to standard. I'd say the more concerning aspect, as with transport, is again the upwards pressure that will be felt from the millions of visitors also looking for accommodation. There are estimates we're seeing anyway of up to 3 million people visiting Paris alone. Paris on a normal day hosts about a population of 2 million people, so it's going to be a big surge in visitors. It might be difficult to source hotels, and the last thing you want is having to settle on a bed and breakfast in an area that is best avoided because everything was left a little bit late. And that's everything from my side on the security end.
Thank you very much, Tarun, for this very detailed expose on the risk in France for the Paris 2024 games. We are now moving to the health risk part with Dr. Arnaud de Rossi. And just before that, I remind you that if you have any questions, either related to security risk or health risk, feel free to include it in the chat tab or the question tab, and we will take a few minutes at the end of the session to answer that. Arnaud, the floor is yours.
Thank you, Laetitia. And after the security risk, we'll now go through the games from a medical perspective, and not only the existing situation in Paris and in France, but also the new situation created by the games, as well as how to try mitigating those risks. The French health system is of very high standard, and its organization is relying on a very dense network of public hospitals, especially large teaching hospitals, large private clinics and hospitals, and private practices. While most of the severe cases are taken to the public facilities, this role is now also fulfilled by some large private facilities. Also, the emergency rooms are still mainly found in the public hospitals. Level of care is therefore usually excellent in most facilities. Also, comfort and customer-oriented mindset is usually better found in private facilities. One comment on these facilities, also situation has been progressing over the past 25 years. English is not widely spoken within medical facilities, and if spoken, this is mainly by medical doctors rather than other professionals, with a French accent usually much worse than mine. In regards to private practices, unlike what is done in some other European countries, it can be accessed directly without a referral letter, as the consultation fee is rather low. The management of emergency situations in France is relying on the private practice of general practitioners, but also mainly on the EMS, the Emergency Medical Service dispatch centers, toll-free number 15, the fire brigade, toll-free number 18, and also the European emergency number 112 can be used. It's linked to the fire brigade. Through these two phone numbers answering 24/7, it's possible to access and to talk to a medical doctor very quickly and get an appropriate answer, either medical advice, dispatch of an house call doctor, dispatch of a private or public ambulance, or even dispatch of a mobile intensive care ambulance with a medical team. Besides this very efficient emergency medical management system, household doctors can be accessed directly. The cost is rather low compared with other European countries. It's ranging from 35 to 90 euros, as well as an appointment can be taken with a GP, and it's even lower, less than 30 euros. But waiting time can be extremely long. Getting a medication is not an issue as long as you get a local prescription. Cost is usually low for the medication compared with European countries, and pharmacies can be found everywhere. From an health risk perspective, I will not elaborate that much on what can be found in France. Nothing very specific compared with other European countries. Just to mention the fact and highlight the fact some risks are present in some areas, namely some mosquito-borne disease. It's related to the arrival in France 30 years ago of the tiger mosquito arrived from Southeast Asia, and unfortunately it has been bringing some disease such as Zika disease, dengue fever, chikungunya disease. This is mainly in the southeast and center of France. It's not that frequent, but it can happen. Also, the well-known Lyme disease can be found in the east and center parts of France. It's transmitted by infected ticks. Besides that, COVID now has a very minimal impact on the daily life in France. Also, we can see a recent increase in number of mild cases. Bed bugs have been mentioned recently in the media, but this is a very controversial topic, as the situation has been described widely across the globe over the past 20 years, and it's related to the exponential increase in international travel. Finally, as mentioned by Tarun, given the weather and climate changes, we can anticipate on possible heat waves in France during the summer period of time. Considering the fact that Paris is a very mineral city with very limited number of green surfaces, any heat wave can have a very severe impact at that time, and the usual precautions should be taken. So what are the strengths and weaknesses of the French medical system? It's an advanced one, relying on a dense network of medical facilities and private practices. Also, its quality has been decreasing over the past 30 years. Why is that? Mainly because of the relative shortage of medical healthcare professionals and medical professionals faced with an aging population. All this has been leading to a significant delay accessing urgent or non-urgent medical care. And eventually, the COVID crisis has affected even further the situation with the disaffection of thousands of medical professionals. Fortunately, the Paris region can still rely on an extremely dense network of medical facilities spread across Paris and its suburb, as you can see on this map. And these facilities you can see are only the public hospitals. Most of these facilities are equipped with a 24/7 emergency room, but not all of them have got all specialties, leading sometimes to inter-hospital transport of patients. This is managed directly by each hospital. And then the Olympics. The arrival of the Games in Paris means 30 million visitors in France expected during that time, 15,000 athletes, 20,000 journalists, and 45,000 volunteers coming from Paris, but also from the rest of France and abroad. This is on top of major. No,
sorry. Yeah.
Sorry, yeah. This is on top of major traffic jam restrictions that can be expected and that will be implemented during the Games, such as, for instance, the cutting of Paris in two parts along the River Seine during the opening ceremony. So what will be the impact on the delivery of the healthcare in Paris during that time? Just a reminder, unlike some other Olympics in the past, the sports sites will not be centralized in one single central Olympic site, but will be spread across Paris or even across France and even Polynesia for the surf event. It means supporting all these sites will be a real challenge. Also that the impact of the Games on the Parisian daily life will be very significant during at least 2 weeks. There will be major traffic restriction, and this will have a major impact. During normal days, Paris is already an extremely congested city with daily hundreds of traffic jams. It might be worse during the Games, with nearly 200 kilometers of streets reserved to officials, accredited cars, and emergency services. Some motorways will be closed from 6 a.m. until midnight, and the famous peripheric, this is an urban motorway surrounding Paris, will have one lane reserved to accredited official cars. On top of this, as I mentioned, Paris will be cut in two parts during the opening ceremony, with most bridges over River Seine that will be closed to car traffic, and the very central Paris might be totally closed to traffic. In order to mitigate this impact on the visitors, athletes, media, and the so-called Olympic family, this is all the Olympic officials, a very strong medical organization has been established by the organizing committee. Each sport site will have will be medicalized by paramedics, doctors, nurses, volunteers, and private providers. Also, a temporary outpatient clinic will be built at the main site called the Olympic Village. This will be a very strong facility able to cope with 700 patients per day and equipped with X-ray, MRI, laboratory, dental support, physiotherapy support, etc. Any patient exceeding that local capacity in terms of expertise will be transported to another public facility. All this will be coordinated by the organization committee medical dispatch in strong interface with the public EMS. There are exceptions for 3 categories using some special fast-track procedures. First, the athletes, they will be taken to the Bichat hospital in the north of Paris. The Olympic family officials, they will be taken to the Georges Pompidou Hospital in the southwest of Paris. And then the media, they will be taken to the Avicenne Hospital in the northeast part of Paris. So, and then finally, I mentioned the Olympic Village with the Central Clinic. If we look back at London in 2012, there has been a very minor increase in activity at the emergency rooms. And actually, it was, at that time, it was even compared to a mild winter activity, which is absolutely sustainable for the hospitals. At that time, only 30% of this increase was related to visitors, and the remaining 70% were related to athletes and officials. For Paris, the assumption that was made is that there will be an addition of roughly 150 patients per day across all the Parisian emergency rooms, which is totally sustainable. So what to expect? First, for a minor condition. For minor condition accessing a general practitioner in its private practice, it's foreseen that many of them will be on annual leave just for escaping the traffic congestion. Household doctors, similar situation, they might be on annual leave, or they will work as volunteers on the sports sites or through private providers. So either general practitioners or household doctors, it can be foreseen that a significant part of them will not work during that time. Access to that type of support will therefore be reduced. Alternative is therefore getting directly to the emergency room. It will be working as usual, but accessing the hospital might be a challenge just because of the traffic congestion. On the opposite, for severe situation, we can assume situation will be better as hospitals are already presently preparing for an increase in staffing. There will be overstaffing their wards and their ERs, and access to the hospitals for the EMS ambulances will not be an issue since they will have reserved lane for accessing. So some solutions. Challenge, as you can see, the main challenge is getting an appointment or consultation and accessing the practice because of traffic congestion. And solutions will be through new options. Household doctors will not be there. So we are now working on increasing and improving access to teleconsultation. Obviously, this is not for all type of situation, but it will be an easy to implement solution, but also working on other solutions, fast track access to some privileged medical facilities, and also hybrid model relying on dispatching a registered nurse with telemedical equipment on site, and then launching a teleconsultation link with a doctor. Ultimately, one message for those patients who are an existing international SOS member, call the assistance center only. This is one of the best prevention measures, and it allows a very quick reaction time if faced with an acute situation. Laetitia?
Thank you very much, Arnaud, for this, again, a great resume for the health risk and some of your recommendations. So we are now moving to our third part of this webinar about how international SOS can support before we move to the Q&A. So just as presented by Tarun and by Dr. Arnaud de Rossi, more than ever, your organization participation in this type of events in Olympic Games, in the Paris 2024 Summer Games, will depend on your ability to manage potential health risk or security risk that can impact on your participants, your employees, your workforce, and the success of your event and on your reputation. As you might know, at International SOS, we have great experience and expertise in supporting global events, but also more local events. And more specifically, recently, we have been able to support some sports events, such as the FIFA events in Nigeria 2009, in South Africa 2010, more recently last year in Qatar 2022, but also for some major sports events like the Euro 2020, Tokyo 2020 Summer Games, and more recently as well, Beijing 2022. So in concrete, how International SOS can support you and your workforce. So we are able to provide you support, obviously before the event, but also during the event. before the event, we always include in our solution what we call the event support plan, which includes both medical and security components, and will provide you with the full dedicated procedure linked to the assistance center, but I will touch base that in a second. We can also support with some health and security consulting, more specifically risk assessments according to your sites or where you're based, the city, the country, but also with some webinars and briefing sessions for your employees, for your attendees, security escalation planning for France or for Paris more specifically, and last but not least, we have spoken about the accommodation. We can also provide with some accommodation reviews and more specifically hotel risk review. That's before the event. During the event, we can provide obviously comprehensive assistance. Today, we are based with Dr. Arnaud de Rossi in the Paris Assistance Center with our team just behind us. This always includes the medical and the security components with a dedicated procedure, a dedicated hotline, and obviously for all your attendees, either local employees or international travelers, but also VIPs and families. We can also continue to support you and your organization with some dynamic risk assessment during the event, during the Paris Summer Games, but also with some support on the ground, either medical support on the ground, like health coordinator on site or on standby, medical supply, but also with some security support as well on the ground. And as mentioned again by Tarun and Dr. Arnaud de Rossi earlier, the issues we will have with the transportation, with some meet and greet services, but also with some secure VIP support like logistics and transports. So we now move on to the end of the session, and I see that we have many questions. So we are going to try to answer to as many questions as possible. And if not able to answer to all of these, we will obviously get back to you by email. So one of the first question is, what are the practical tips to safeguard groups that are traveling to watch the Olympics? I guess this one is more for you, Tarun, on the security perspective.
Sure, yeah, I'll take that one. I mean, I think given, like I mentioned, the low risk environment of France, for most travelers, basic security precautions will do the trick. It almost goes without saying that essentially any groups or any travelers should basically just do their best to not paint themselves too obviously as tourists. So don't walk around with expensive jewelry hanging off you, don't have a big iPhone poking out your pocket. If you're sitting in a cafe somewhere outside, don't leave your wallet on the table in an obvious position. Someone might just run up and snatch it. People have seen it happen before. This should be more than sufficient in reducing the risk of being targeted by petty thieves. When it comes to, I guess, protests, you're just going to want to make sure that the traveling group bypasses it. Like I said, they have a tendency to be quite heated. Violence is not uncommon. Tear gas is pretty common. So as a manager, you'd probably just want to be cognizant of any scheduled demonstrations or aware of any spontaneous unrest, because you'll then need to make the decision to either change travel itineraries, maybe organize a taxi. It's not really rocket science, but yeah, just making sure that the traveling group is briefed on the potential risks. And then at a manager's level, anyone in charge of overseeing the security just needs to make sure that they have the relevant information to enable them to make those decisions.
Thank you very much, Tarun. And just adding on top of that, for all the international SOS clients, obviously you still have access to the assistance center that is working actively on supporting our clients during this event. You will have access, obviously, to all the information and analysis capabilities. So always, please feel free to have a call with the assistance center to get more advice according to the trip, to the people who are traveling, and to be to have the best recommendations according to the profile of the traveler. We have another question on how far in advance should we start preparing for the games? I guess this one again is for you, Tarun, on the security component.
Sure. Yeah, I mean, as you can already see, we've begun preparing, and I think given the size of the event, the complexity of the arrangements that are needed, the competition, like we mentioned in terms of acquiring accommodation or transport, planning really should start as soon as possible. The knowns are now clear in terms of security risks, health risks. You know, in terms of security as threat, there's threats, there's crime, terrorism, social unrest. How you as an organization plan to mitigate those risks, that can take some time. there are so many factors that need to be considered. You're all very busy, I imagine. Other events will come up, other responsibilities will take up some time. So best to get a head start now.
Perfect. Thank you very much, Tarun. And yeah, again, adding on that, we are in November and we are already having this webinar about the Paris Summer Games. So obviously, the more in advance we have this kind of discussion, the better. And we can assure you that we are already discussing with many organizations on the setup for the Paris 2024 Summer Games. I have another question, this time more for medical. So any chance to get a doctor with the traffic jam? I guess this one, Arno, is for you.
Definitely, and this is indeed one of the main challenge we think we'll be faced with. And actually, it's depending on what type of situation. For minor condition, this will be a challenge because I mentioned that house call doctors will be aware or not able to access. So the solutions we are working on is through dispatching registered nurses, possibly on motorbikes with telemedical equipment, establishing a link, a telemedical link with a consulting doctor. So this is one of the solutions. And the other one would be just getting to the ER. And again, it's a case-by-case discussion and better calling early the assistance center for talking to a doctor, for getting the first recommendations, and then deciding what's the best option. This is for minor condition. For more severe conditions, acute conditions, obviously the emergency medical system will be working and is already working on mitigation solutions. They will be able to dispatch ICU ambulances, intensive care unit ambulances. So this should not be a real issue for the more acute situations. Most likely, the EMS will be able to cope with that. They will have reserve streets and so on and so. But for more minor condition, it might be a challenge, and therefore better calling the assistance center for looking at what makes sense.
Thank you very much, Arno. And yeah, on top of that, again, as mentioned, if you have any question or if you want to discuss about any specific or dedicated setup about medical support on the ground, we can support with that, obviously, as well on the security support on the ground. So I guess this leads us to the end of the session. Thank you very much for attending. We just take one last minute to present you that we will have a webinar on the Middle East crisis briefing this Thursday on November 23rd. And as mentioned by Tarun earlier, we will have a similar session in April about the Paris 2024 Summer Games, really a few weeks before the events. So thank you very much, everyone. And Jennifer, over to you.